So we are going to be doing this panel session on the value of investing in health. So I'd love to invite my panelists to please come and sit down, and I'll introduce them. So we have Mark Hicken from Janssen Europe, Middle East and Africa. We have Stefan Majkowski from LifeArc. We have Tamsin Scoble from Deloitte. And we also have David Morgan from the OECD. So it's really great to have you all with us. Thank you very much for your time. So let's get straight into it. We know that these are challenging economic times in many ways. We know that budgets are stretched. We know that businesses are struggling. We know that charities are not as well funded as they might otherwise have been. What is the case that you're making to people that you're working with and talking to about the value of investing in health? Maybe start with you, Mark.
Yeah, sure. Thank you. Thanks, Georgia, and thanks everybody for joining. So why invest in healthcare? Well, because a healthy population is a good thing for a whole bunch of reasons, and we know that investing in healthcare innovation delivers longer and healthier lives. Healthier workforce is a more productive workforce. So on a rising tide, all boats get lifted. So that's good, generally a good thing to do. I mean, obviously, as you've said in your intro, we recognise very much the challenge of austerity. The challenge, of course, that we're seeing at the moment is short-term cost containment having potentially unintended long-term consequences. The message it sends, and some of the choices that are being made around innovation adoption, particularly. Now, I think what do we do about it? We have to partner. So we want to come to the table as a deliverer of innovation with budget holders in healthcare delivery systems. To be able to work together to address some of these challenges. We have to create the headroom for adoption of innovation if we're going to transform lives, if we're going to make a difference and help people live longer and happier lives. Now, another part of the equation here has to be about how we view health and how we evaluate what constitutes innovation and what constitutes value. And we need to take a broader look across the health and social care space. Some good opportunities right now, as many of you know. The draft EU policy on pharmaceuticals is in discussion across member states and due for implementation soon. So there's a real opportunity to put the right incentives in place. And also we have EU HTA, the single joint clinical assessment. So the way that the payers are going to view innovation from a pharmaceuticals point of view, also in phases of implementation now. So a couple of great opportunities to set the right course for the future and make sure that we are continuing to invest in the right way.
How about you, Stefan?
So it's a broad topic, and there's a number of ways of looking at it. But first of all, from the patient's point of view, there's a very clear need to listen to the patient, what the patient wants, and sometimes it can be quality of life issues, not necessarily very difficult treatment to get. So patient at the forefront is absolutely key. The UK has got a fantastic reputation in discovery research, but often it stops at the scientific discovery. And that at LifeArc, what we do is then translate that and get it closer to the patient, closer to clinical trials. The UK also has an enormous wealth of talent in life sciences. I think it's almost 300,000 people employed by life sciences, and a quarter of those in SMEs. So again, we invest in small companies, help them to thrive, so it creates jobs as well. Getting and the last thing I would say probably is innovation, because if we can get more into prevention, early diagnosis, and just not focus always on treatment, then you'll get a much healthier population. I think there was a study recently done which said that between now and 2040, the preventable number of cancers will cost the economy £40 billion, which is just extraordinary, almost 2% of the GDP. So from a large number of points of view, it is very important to invest in health and also partnership between government, industry, charities, academia. There's just so much that the UK can provide.
Great. Tamsin? slightly different perspective from you, I think.
Yeah, slightly different perspective. So, hi everyone, my name's Tamsin. I'm a manager at Deloitte, and I work with companies all across the world to help them with their wellbeing strategies and their wellbeing cultures. And I really focus in on helping them to understand how to quantify the impact of investing in wellbeing and health of employees. And I guess a place to start here is that there's 33 million people in the world, not in the world, in the UK, employed at the moment, and we spend a third of our time at work. So there's a huge opportunity for employers to be focusing more on the well-being of people at work. And at the moment, we're not getting it right. We're not getting it right at all. I think as a baseline, employers should be making sure that people are not being made more sick by being at work. And unfortunately, 55% of people feel that they are actually having a negative impact on their mental health because of workload and stress. So it is a real problem, and I'm really passionate about helping to fix that problem for organisations and help organisations to see how they can make sort of measurable and sustainable change. So I'm looking forward to talking about that a little bit more.
Great, thanks. And so Tamsin's you've touched there in terms of perhaps the impact of ill health and the detrimental impact that can have in the workplace. David, I'd love to come to you to get a sense of how should we actually be thinking about measuring this value? I know you've done a lot of work thinking about this.
Yeah, just to introduce myself first, David Morgan, I'm at the OECD in Paris. So we're looking broadly across a lot of countries. And of course, we had a big experiment from the pandemic, so we could see how health systems really performed and what was important with regard to the overall economy as well. I think it was mentioned, the people working in the health and social area are responsible for about 10% of the whole workforce, and it takes about 10% of the economy in richer countries. So it has a huge impact in the overall economic, the economies of the countries. So we could see from examining after the results, through the pandemic, looking at some of the health outcomes and some of the economic outcomes about, how important investment in the health system was for the performance of the economy in more generally in its socio-economic indicators, in its productivity. Obviously, you can see a healthy workforce. A healthy population leads to a healthy workforce and a healthy economy.
And something I'm really interested in, so I cover health as a journalist. And one thing I'm thinking a lot about is we've got these limited resources. We all, as you pointed out, understand that it's very important to be investing in health. But since we've got kind of such different perspectives here, I'd be very interested to hear, is it possible to say where the greatest value can come from? Are we talking about pharmaceutical interventions? Is it about well-being in the workplace? Is it about broader health promotion that we've heard so much about in this conference? Is it possible to kind of discern between these kind of three different things? And do you think there's one that we should be valuing above all others? I guess just to throw the cat among the pigeons. Anyone want to go first?
I don't mind starting. Obviously the best thing to do with disease is to avoid it. The best thing to do with good health is to maintain it. So I would agree prevention in all its forms. Now, whether that's through strategies, helping people in the workforce, whether it's through avoiding spread of disease, whether it's through vaccination, whether it's once you become ill, you get diagnosed and then you have a therapy, the more we can invest in new platforms or new treatments, cell and gene therapies, things that can truly modify disease and change outcome. So from a pharmaceutical point of view, that's where you'd want to focus and say, actually, if you can really change the trajectory of a disease, cure a disease, or prevent further deterioration of health, that's an investment worth making. But clearly, I think we'd all agree avoidance of disease and avoidance of ill health is the best way to go.
Anyone else got any thoughts?
I can jump in because I agree. prevention rather than cure. Our health systems are very much based on treatment of disease rather than getting to that point. Across the OECD countries, we spend a minimal amount. We spend about 3% of the total health budget. That's public and private altogether spending, which seems a very low amount when you see the benefits in the long term from further investment, whether it's healthy living or tackling specific diseases through screening, etc. It's a small amount. It hasn't really shifted because you need a long-term vision, and that's what a lot of governments are not having at the moment. They're not looking towards a long-term investment in health promotion. Saying that, it's not just a government issue. It's everyone plays their part, from the individual through to the workplace, and it's, we're not talking. It's just down to the government to be putting the effort into health promotion.
I think one area that would really benefit from acceleration is technology. So there's such advances now with data, big data analysis, data science, health technology, and if we can invest in this area, then there should be significant differences in the time it takes to diagnose and in some cases to treat. Mm. And one example I'd mention, for example, not too far from here, in the Knowledge Quarter, where you get both health science and technology organizations close to one another. There's some really great partnerships. For example, the KQ Lab Accelerator, which we funded and is run by the CRIC, is an example of this. Looking at putting money into small companies that really focus on technology.
Yeah, and I think I'd agree with what everybody said, and I guess add to that it really depends on what individuals need. Like if someone is ill and is at a crisis point, they need intervention from a health specialist. They would benefit from advances in technology, etc. If someone is at work and is feeling stressed and overworked, their hours are really long, they're not going to benefit from a mindfulness session being added into their day, filling up their workload. So for me, it's about really understanding what the need is, and something that we have at Deloitte is something called the NICER assessment. So what are the needs, interests, concerns, expectations, and prevalent risks of the workforce? Once you understand what that is, then design your wellbeing strategy to address that. And it sounds really simple, but I think a lot of people don't do that, and a lot of organisations are investing lots of money in really sort of bells and whistles solutions which aren't actually addressing the root cause of the problem. So I think my argument there is really understand what the issues are, what your workforce needs, what the individual needs, and then design the appropriate solution around that.
Great. So a bit less controversy than I thought, but I think that's really interesting, is that you've all kind of made a case for prevention, a case for being proactive, while also being able to support people who do need the support and the latest technologies and treatments. But I'm curious, how do you think we should be making, the argument, that case for that longer term investment? David, you talked about only 3% of many budgets going on prevention. We know that governments understandably tend towards perhaps a more acute end of treating illness and ill health. What do you think about in terms of making that argument to policymakers for that more sustained investment, and in your case, Tamsin, to employers for that proactive care?
I think for me there's three things that are really key to remember. So obviously, and I think in the room everyone would probably agree that morally this is the right thing to do for people. That's why we should be investing in health and in well-being of people at work. But also financially, it's the right thing to do. If you look at attrition, if you look at attraction, if you look at retention, and you work out the numbers, you create a business case, you take that to your senior leadership team, to your CFO, and you put it on top of the board agenda, they will listen, because those numbers are huge. There's a massive amount of impact that you can make with just looking at the numbers. And then the last one is legislatively, I can never say that word. CSRD has come out recently, the Corporate Sustainability and I've forgotten it. The Responsibility Directive, something like that. I'm going to really kick myself later for not remembering that one. But there's a social element to that. So organisations are, they have a responsibility to actually report on the data and the metrics around social issues and well-being at work. So for me, there's 3 key reasons why you would sort of invest in well-being and health at work, and look at that as a long-term sort of solution and strategy.
And maybe to add, I mean, as Stefan said, talking about the cost of, treating cancers, the alternative, if you don't take a long-term view, and we all understand the challenges of, reform in a healthcare system or investments, typically significantly outlive political cycles, and we know health is a political football, just like education. So there are misaligned incentives in the system which make it even more difficult. And so the sort of collaboration needs to almost take place outside or in spite of that. But it's simply unaffordable to not do something else. So if you look at the burden of care, I mean, look, for example, at mental health concerns. We all know about Alzheimer's, we all know about dementia and what's going to be happening with an increasingly elderly population. So the alternative is to wait and treat everybody when they're ill is simply unsustainable and unaffordable. So start early, prevent, try and help people to help themselves and make good choices, empower people to make those choices. Start early from a medicine's point of view, things like cell and gene therapies, identifying early patients that are predisposed and making interventions before they become ill is much more cost effective. So there are ways that we can do it right across the spectrum, but the mandate has to be the alternative is simply unaffordable.
Yeah, I completely agree. And I would say also that having a consistent investment which is not stop and go for years is very beneficial to the country at large. For every government pound invested, you crowd in £2 of private investments, you get a benefit of £7, and you're more likely to generate these new therapies, new treatments for patients. And as I said, on the economy side, you create jobs, you attract talent worldwide, which is needed. So it's a virtuous circle if you invest in health.
I think coming out of the pandemic, a lot of individuals and governments realized that health was a priority. It was important for the economy. The problem is the memory is a little bit short term, and things have happened since then, and other priorities are kind of starting to push health down the pack a little bit in terms of green transformation. Not that these are not important things, but health has to fight its place as well in investment, and very much so in a long-term investment, and not just the length of the next parliament or whatever. So what can governments do in that? It's they can. The options are to raise more money. That's not really viable at the moment, of increasing taxes or even really shifting more of the budget onto health, because, as I said, these priorities. So they need to start looking at yes, the role of the private sector as well in terms of some of the care that's given, some of the what should be covered under a public budget, what should not be. There are things at the edges as well in that case. But there's also the efficiency angle. Even within prevention, I said it was a small amount, but when you start digging down into that, some of that spending is perhaps not the most efficient spending either, if it's just those kind of ongoing health checkups, which are perhaps not necessary every 6 months or every year. It could be less. So it needs to be smart investments as well in the area of prevention, but there's plenty of other. We talked about digital, and I know there's other sections on digital, but the health sector is known to be very slow in its take-up of and its use of digital solutions and tools compared with other sectors of the economy. I mean, I heard the other day that health is producing a huge amount of data. I think it's about 30% of all the data that's out there. But it's only about 1% of that is being used. So it's, there's the possibilities and potential for so much more to be done.
And I think that's, it's an important point, isn't it, about efficiencies within, existing budgets. And we know there is. I mean, it's inevitable within health systems, but there is, quite a high degree of wasteful spending, which could be done better. But I'd love to kind of think a bit more about, David, you touched on, different roles and kind of partnerships. Stefan, you talked about, the private sector. But I guess my question is, who should be doing what? What's the role for the state or the government when it comes to investing in health? What should the private sector be doing? What's the role for charities such as LifeArc, and what should they be funding? I feel that often these kind of divisions get blurred, understandably so. But there has been a bit of a shift, hasn't there? Coming out of the pandemic and kind of who's doing what. I wondered if you had thoughts on that.
Yeah, I mean, one of the challenges often that when you work in the private sector, that you face is there are sort of, I don't know, philosophical or ideological conversations to be had about, is it okay to make money out of health? So that's a conversation we need to get over. If you want to see money coming into health from people that buy stock, shareholders, they're going to expect a return. And in a high risk business, that's not an easy thing to do. But I think the place of private money is to maybe underwrite some of that risk, is to take those gambles, and to drive on the side of innovation. It's also to help create that headroom for innovation, to bring in new disruption. Often we see when we bring new innovation in, that healthcare systems are not in a position to adopt because budgets, for good reason, are siloed. And trying to explain to somebody you can spend more here to save over here simply doesn't get traction because the incentives aren't in place to do that. So there are times when we can partner. Now, for example, in industry, managed entry agreements, the way that we partner on healthcare delivery, there are things that we can do alongside innovation or advances in health that can help pump prime and prepare the system to adopt. And I think that's an important part that we have to play, particularly in publicly delivered healthcare systems, which tend to be less agile.
Yeah. I think from the charity sector point of view, not for profit, it needs to find its place and not compete with government or industry. I mean, to me, it can operate in areas of high risk, where probability of success is really tough, where there's commercial uncertainty. And so that's what we tend to do is operate in that sector where for industry it's really difficult to put significant sums in there because we can take that risk. Of course, it's informed risk. We also invest in early ventures, but do a lot of diligence to make sure that there's a high likelihood of being successful. But going back to the patient need and putting patient at the front, there are areas. I mean, I can give you a few examples. Where we play a role: motor neurone disease, rare diseases, childhood cancers, antimicrobial resistance. These are examples where the business model is very uncertain. I think charity can play a big role in that area.
Yeah. What about the role of the state, in your view, David?
The public-private division of spending and health spending is quite an emotive subject, and because you bring up issues about equity of care and creating two-tier systems. So, and you saw during the pandemic that the state in most countries stepped in to cover a lot of the additional spending that health spending went through the roof almost for a couple of years on covering the necessity of what was seen as a public right to be protected. So it's a difficult one, but as I said, there are areas at the edges and the margins where I think we need to look at what the public purse is covering, because as I said, we're at 15% of government spending, 10% of GDP. We see that aging in our societies are going to create very much more additional burden on the public purse if we don't start to look at these issues of how the private sector plays a role in different areas as well.
No, I think we're in a very interesting time, aren't we, in that regard, where the case, clearly I think we'd all agree that health is worth investing in, but as that number keeps going up and up, that may be a case that's more and more difficult to make. So I think what you've touched on in terms of the inefficiencies, the partnerships, all of that's really key to make it sustainable for the future. I've got lots of questions, but I'm aware that we've got, a really diverse kind of array of panelists. So I wondered if anyone in the audience has any questions. Yeah, thanks. If you introduce yourself, that'd be great. Thank you.
Hi there. I'm a public health doctor, actually, in Scotland. And I think it's really interesting, that final point about the public and private sector and how do we get along, because I'm getting sledged by my colleagues for coming here. Really, in Scotland, public health is very much within the NHS spend domain. It's different down in England and there's different systems. But we talk a lot about trust of people's individual data and how we build trust to share with the NHS. How do we ensure that the public, and it's now you move into prevention, which is my domain, how can we work together and build that relationship of trust whenever we come from such different ideologies? And how do you see that working now that you're moving into my patch?
Does anyone want to take that?
Do we have different ideologies?
I would argue whenever you've mentioned the two-tier system of health, we have seen there's theories about Rose's paradox of health or widening inequalities with interventions. And I think there's concerns about if the private sector is willing to adopt these ideologies, these methods that we use of evidence-based and rigour to then work together where there's conflict in shareholders.
Yeah, so I think, I'm not sure that we have different ideologies. I think everybody wants a healthier and happier world and a more productive world. It's good for everybody. I think that the matter of trust is really important. I absolutely agree. Thank you for sharing that you're being sledged and being honest. It's such a shame, but that's something we have to get over. And it is this kind of ideological conversation about, is it okay to make money from health? I think that we're very much about evidence to demonstrate the value that we can bring in terms of innovation. And we certainly, part of the whole evolution of what, just talking again from a shareholder point of view, we're aware of the evolution of ESG goals, what we're trying to do from an accountability point of view as publicly listed companies. And the more society and shareholders demand of publicly listed companies in terms of social responsibility, then the more you're going to see that in the goals of organizations. So I think shareholders have a role to play in terms of holding organizations to account. But generally speaking, we coalesce around the same goal, which is driving better outcomes, which we can demonstrate through evidence, adopting new health technologies to try and keep people healthier and happier. Building relationships of trust is really what the challenge is. And that can only be, you develop trust relationships by fulfilling your commitments and your promises. And I think that's where we have to start. Maybe
Well, I think also public engagement is very important. If you look at what happened during the pandemic and all the vaccine rollouts, I think public engagement was critical. And also partnerships. I think if you have partnerships between private and public and the not-for-profit sector, then you get the best of all worlds and contributing what they're good at.
Does anyone else have any thoughts? No?
Just to echo, really, the importance of trust, as you said, was particularly important during the pandemic, of losing the trust in some countries on the efficacy of the vaccine. So, and yes, partnerships.
Great. Anyone else with a question? Yes, thank you.
Thank you so much. Zoya Kias World University Rankings. It's wonderful to hear your unanimous agreement on prevention being so important, but I'd be interested to hear a little bit more on awareness and how your organization engage with not patients, but before they become patients, youth, academia, universities. We run global campaigns on SDG awareness, on climate awareness. I'm yet to see a health awareness campaign in academia, and I'm not talking on the national level, but more like regional or global. Thank you.
Thank you. Anyone want to go first?
I mean, we've done work particularly looking at the level and the lack of health literacy in populations across the OECD, and I can only agree with you that the importance of it, and it's where so much more work needs to be done, particularly in relation to the use of the internet and things like that. But it's all part of health across the whole government or the whole economy of getting the importance into the schools, the education system, the workplace, and everything else.
Yeah.
Yeah, you don't look convinced. I mean, I will add that. I mean, obviously, you know, what we do as an organisation, particularly, I mean, what Tamsin's been talking about, which is starting with our own workforce. How do you create a healthy workforce? How do you allow people to get the right work-life balance? How do you recognise diversity in workplace, allow people to come as themselves, all of which can help from a mental health as well as physical health point of view. So we start with our workforce, but we also, as an organisation, we take our responsibility to the communities in which we live and work very seriously. We have as an organisation, Johnson & Johnson has a credo. It's a way that it works. One of the paragraphs in the credo talks all about, and very much the commitment that we have is about, you know, giving back to the communities that we live in. And part of that is about education around health issues and how do we help people. And a big part, the literacy issue is one. The second is how do you bridge? So we have a bridge to employment program. So we mentor young people across the world in a number of schools, particularly in more socially deprived areas, where without interventions, you know, without the right role models and without the opportunity to see themselves, if you can't see it, you can't be it in a workplace, people just don't have those dreams and aspirations. So trying to get more people to come through STEM, particularly females, STEM topics. So we do have, through those programs, an active footprint globally. Here in the UK, I can tell you more about it, but we don't have time right now. But we take that very seriously.
Anyone else with a question? Gentleman there, thank you very much.
Thank you. Thank you to the panellists. My name is Charles House. I'm Medical Director at University College London Hospital down the road. And we're sort of right at the far end of the investment in treating people when they get unwell. The panel all agreed that we should shift to preventing ill health. It's the reality that in the short term, in order to do that, we have to spend less on treating people who are ill.
Great question. Anyone want to try and answer?
I think, I mean, from my point of view, I go back to innovation and technology, and if we can make some of the costs that we're currently incurring a lot more efficient, that should hopefully free up some money for prevention. I think that's probably one of the most realistic ways of getting there.
Just to add, I fully agree. I think you creating the headroom for innovation is one of the bigger challenges. So create the space to adopt innovation that frees up resources which can then be reinvested in prevention is absolutely the way to go forward. But the unfortunate practical reality is, starting today, there is disease to manage. And there are people who are unwell. And typically, you see it converge in spaces where there's you know, the social side of things is also not so great. So typically people who are more disadvantaged get unwell, the health outcomes are worse. So we can't leave the disadvantaged people. So there is going to have to be both. But I agree that sort of investment in innovation, this is where it can really help, is to free up those resources. But we do need that fluidity in the system. And we do need to partner on how we move out of siloed thinking to free up resources, which is not very easy to say, not easy to do. Fully appreciate.
Yeah, no, I'm passionate about this issue. So I think it's a very difficult dilemma we're in, isn't it? And I think there's some very tough political choices to be made. And I'm not sure we're having that conversation at the moment, at least in the UK. But I'm not on the panel. Anyone else got a question? Yep. Hi.
I've got a question actually for this gentleman from UCL, which was where I went to medical school. I'm a surgeon. And using the surgical principle, can we not look at simplicity? There are simple ways of, and this is a question as well as my way of statement, of increasing prevention. And I'll give an example. I see patients every day. The ones who come from towns, they may never have seen a cow. They don't know where food comes from. They don't know how to cook because their parents haven't got the time, so they'll get a burger. So simple things that possibly in the community, why not use village halls to actually have classes and things, use things that are there, that are cheap, to increase the education from the start. If a child learns, as I did in school, about eggs and things, they'll teach their parents. And so that's a cheap way of getting the prevention going while you work on innovation. And I don't know what you think of it. Or is that too simplistic?
I wonder, maybe you can chat afterwards. Great question there. I wonder if anyone's got any thoughts on
just
that.
one comment I'll make on this. I remember a few years ago, Sally Davis, who was the Chief Medical Officer, looked into sort of providing advice on prevention. And the next few days, all over the papers was, the nanny state, sort of leave us free to do what we want. So you also have that to deal with. I think it's a really tricky... Exactly, that's a much better way of doing it, I agree. Yeah.
Agree, and there are also, the whole... one of the great movements that we're seeing coming out very strong in the UK, the social enterprise. So businesses that are all about the triple bottom line in creating social value. There are some tremendous work being done. We partnered with one organisation called Empower to Cook, who are all about teaching the basics, the fundamental skills, giving people the skills that they need. People that maybe aren't as literate, maybe they've come to this country from another country, maybe they have not done so well through school. For whatever the reasons are, the people just don't have some of those skills that are going to help them. And there's some tremendous work being done which does energise communities. And I think it's also incumbent on private enterprise to be partnering with organisations like that, because we can help. We often have a pretty big footprint in communities. We may be employing lots of people. So we also try and leverage our scale where we can. And I think that's also something which is expected more of corporations.
Have we got time for one more quick question? Anyone got a really quick question? Yeah.
Thank you. Thank you for the great discussion. Just thinking about closing the gap between research and then policy, what do you think would be a good area? Because there are loads of papers showing global burden of disease, what is the benefit of investing it? Is the way to continue to work on those papers, and I think the different areas will focus on the areas that they are focused on. So I would do research on why surgery is important, whereas my colleagues would do on why cardiovascular prevention is more important, for instance. Or do we need to shift our research focus in something else to demonstrate the value of investing in health, but not from a global burden perspective? Thank you.
Okay, great way to finish. We could think about that, or we could have a go.
I think it's a pretty compelling case already. There are more questions than answers, and I think it really the discussion is about how do we free the resources to address some pretty compelling cases that have been made about addressing the global burden of disease across a whole variety of a whole spectrum of diseases and different geographies too. But.
Okay, well, maybe we'll end there. Thank you so much to all of our panelists, even, and I will now hand back to Grace. Thank you again. Thanks.
Thank you.